What everybody should know about root canal treatment. Root canal treatment has become very popular mode of dental treatment to prevent losing teeth, and RCT, what is the word used for root canal treatment, is a very popular term today. A lot of our patients know what is RCT or root canal treatment. In order to understand root canal treatment, let's understand the anatomy of a tooth. How is the tooth composed of? A tooth, a natural tooth, the top, it has three layers. The topmost layer is called enamel, and this is strongest and hardest structure in the body. We all know that if suppose there is a disaster or some emergency, the teeth are used to identify the individuals. Why? Because teeth are the hardest part of our body, and they will be the last to get disintegrated. So, and that hardness comes from the topmost part of the tooth, which is enamel. The next layer is yellowish and slightly softer, called dentine, and the layer below it is the pulp, which has got all the tissues, blood vessels, nerves, and that is the part which is normally affected when a tooth decay advances. It affects the enamel first, then it affects dentine, which is the second layer, and the third layer is pulp. So it involves the pulp, and once pulp is involved, we only have two options: either to get tooth extracted because there would be pain, or if you want to save it, the only way is to do a root canal treatment. So what is root canal treatment? It is it involves a series of steps. What happens that the extensive tooth decay, which is associated in advanced stage where root canal is required to be done, that is removed first, and after that all the infected tissues, which is in the pulp, that in the nerves, the blood vessels, all that, and in the root of the tooth, because the pulp also has tissues in the root of the tooth. So all that is removed using a special root canal instruments, and it is enlarged so that the healthy tooth structure, inner part of the tooth structure, that is exposed, and all that softer, decayed, infected tooth portion is eliminated using these special instruments, and the entire area, that is pulp, and the canal in the roots, that is disinfected, kind of sterilized, so that there is it doesn't have any infection, doesn't have any microbes, it doesn't have a tissue, remnant tissue, and then it is filled with the inert material, filling material, and after that we put a temporary restoration over it, and we wait and watch, and invariably that temporary restoration is then replaced by a permanent restoration. Most of the situations, there is extensive tooth loss, so we may have to go in for a crown cap over it, because tooth has become inherently weak, it might fracture, but many a times when there is an adequate amount of tooth structure, especially anteriors or otherwise, and we do a bonded restoration, we might get away doing a crown, because doing a crown means we are again preparing a tooth, we are undermining the tooth, a tooth which has already been undermined because of that tooth decay and root canal treatment, and if it is further reduced, we are undermining it. But again, it is a clinical situation. A dentist has to make a very prudent decision, what is required, when is required, and what is to be done. The moral, the carry home message is that today all the teeth which are otherwise due for extraction can be saved, can be prevented from losing by doing a root canal treatment. Of course, there will be many situations if there is the tooth is mobile, if tooth has lost the anchorage, bony anchorage, or tooth is extensively damaged, or if the tooth has got some extensive infection, in that situation even root canal is not going to work, and ultimately we have to get the tooth extracted. So the moral of the story is that let us not reach a situation where we have to get the root canal treatment, and if we do a little bit of prevention, we either avoid getting a tooth decay from taking place, or if tooth decay has occurred, we get it restored or we get it managed in the initial stage itself, we can prevent root canal treatment being carried out. But if there is a situation, please do not wait, get the root canal treatment done, which is purely totally safe and a very contemporary way of saving our teeth. Get it done and do not get your teeth extracted.